Our children are the rock on which our future will be built, our greatest asset as a nation. They'll be the leaders of our country, the creators of our national wealth, who care for and protect our people. This statement was made 25 years ago by President Nelson Mandela. We commemorate this year's World Day Against Child Labor 3 months after COVID-19 was declared a pandemic, which poses real risks to the global efforts in eradicating child labor. Now more than ever before, we must protect children globally, particularly those in Africa, from child labor. Globally, about 152 million children between 5 and 17 years are victims of child labor. 73 million of them are involved in hazardous child labor, which is work that places their health, safety, and development in considerable risk. The good news is that child labor has decreased globally by nearly 94 million, which is about 40% since the year 2000. However, this does not apply to Africa. Progress in the fight against child labor seems to have slowed down. With the equivalent of 72 million in child labor, Africa has the highest prevalence in both absolute numbers and percentage. Now, the COVID crisis has increased economic insecurity, disrupted supply chains, and seriously slowed down manufacturing. Approximately 85% of employment in Africa is in the informal economy. With the significant loss of income by parents, absence of even basic social protection, and increasing poverty, many could resort to child labor. Some studies suggest that a 1 percentage point increase in poverty can lead to at least a 0.7% increase in child labor. In normal situations, effective action against child labor must address a full range of vulnerabilities that children face and requires the implementation of policies and programs which address root causes and result in sustainable solutions. During these challenging times, the ILO, its constituents and partners will help to build back better, including giving special attention to the gender dimension. Our development cooperation support in Africa pushes for more accelerated action in supply chains, innovation, and knowledge sharing to help achieve the Sustainable Development Goal 8.7. Most ILO programs implemented in African countries in the wake of the COVID-19 pandemic are now taking accelerated action on protecting the health, jobs, and incomes of workers. These interventions include a focus on more comprehensive social protection, while at the same time ensuring continued education for children. The ILO is also expediting action to strengthen the capacity of government, as well as organizations of employers and workers. All this work requires partnerships and scaling up. In this regard, we welcome the adoption of the African Union 10-year Continental Action Plan on Child Labor by African heads of states in February 2020. The ILO is proud to be associated with this. As I conclude, it's important to remember that SDG Target 8.7 calls on member states, constituents, and other relevant stakeholders to work collectively to eliminate child labor by 2025. The clock is ticking. There's a sense of urgency. We only have 5 years to deliver this global result. It definitely can't be business as usual. The target can be achieved. Indeed, the target must be achieved for some of the most vulnerable in the world, those we cannot afford to leave behind. Thank you.